All right. We'll just be a moment. We want to welcome all of you. Thank you for coming to attend today's webinar, Managing COVID Documentation and Tracking Requirements in the Workplace. We just have a couple housekeeping items as you're getting settled in. You're welcome to use the chat. You'll find that in the bottom right corner of your screen, and you can drop in an introduction. I want to just welcome Aurora, Suzanne, Nadine from all over the country. We're glad you could join us today. Feel free to drop in, your job, your title, your role, questions that you have, challenges that you're facing, and we'll be happy to tackle those both during the presentation and then also towards the end where we have a Q&A session afterwards. So I'll get started here, and we'll jump right in with introducing today's speaker. Today with us, we have Dawn Adams. Dawn is the president of HResults, a Wisconsin-based HR and organizational development consulting firm. Dawn is a respected, successful human resources and organizational development professional with 25 plus years of progressive experiences. She helps individuals, teams, and organizations reach their objectives through collaboration. Dawn is excited to share with you some of the latest news, as well as things that she's seen out in the workplace and out in the world with all of the new news that we have even this week. So we're excited to jump in there. And Dawn, thank you so much for joining us.
You're welcome. Thank you, Jen. I'm looking forward to speaking with everyone and helping you to kind of navigate the situation that we have as far as what do we need to do to track vaccinations and to better comply with some of the COVID-19 regulations.
Excellent. We're so glad you could join us, Dawn. And then additionally, we have Catherine Singer, who is our customer success manager at Calcium. And Catherine and Frank is our managing partner at Calcium. They both work together with employers specifically to launch COVID programs. So they are your SME, your experts that will be here too to answer any questions. They're both very familiar with the challenges and changes and flexibility that is needed. So they'll also be available as part of our Q&A. So with that, I will hand it over to Dawn, and we'll talk about what goals we would like to accomplish today.
Great. Good morning, everyone. As Jen mentioned in the chat, as far as what are some of the policies and procedures that you have, what are you running into that is a struggle? But our main goals for today, number one, is to explore the requirements. So obviously we have various agencies and organizations that are sending down requirements and are trying to pass legislation. So we will talk about that a little bit today. We'll talk about how do you handle exemptions. There are 2 exemptions that need to be offered to employees in addition to accommodations if they are requesting an exemption from the vaccine. So we'll discuss that. How do we apply these different requirements and regulations? And then how are those enforced? I think many times regulations and edicts come down, and I'm asked many times by clients, how are these going to be enforced? And I think how fiercely will they be enforced? And we will share resources about what are the regulatory changes and what are some websites and some other resources that you have available to you, especially on the internet, to be sure that you're staying up to date. And finally, we'll talk about technology and tools. There are easier ways to manage this using different technology and tools, and certainly Calcium has an answer as well. So here's what we do know. Obviously, this information is rapidly changing. The landscape around the whole pandemic is changing. We want to talk about being sure that your employees are given relevant updates as soon as possible so they can make the best choices for their health and safety, preparing them for life after the pandemic with updated policies, and certainly during this as the different waves of this and the different strains come through. And then creating an environment where employees feel comfortable sharing their thoughts, speaking about their experiences, and as I mentioned, certainly requesting an exemption if that is applicable. So what does this week's news mean for the organization? This is related to OSHA. So although OSHA withdrew its enforcement of ETS, which is the Emergency Temporary Standard, they are proposing a permanent standard. So it is likely that OSHA will apply again and try to put in some type of permanent standard for all organizations. So it's likely that we will see that by the end of the year, and it requires vaccinations or testing for most employers. At this time, that has not gone through. And so what we will talk about more today than OSHA standards is the EMS. CMS. So what is the CMS? The CMS applies to organizations that are providers or suppliers with Medicaid or Medicare. So that could include long-term care facilities, hospitals, ambulatory surgical centers, critical access hospitals, and the list goes on and on. Although many schools are receiving Medicare and Medicaid, this does not apply to schools. The caveat to this is you need to be sure that you're also checking any kind of local or state or industry specific regulations that apply to you. So the CMS requirements themselves are related to employers of covered facilities that you must track and securely document your employees' vaccination statuses. You also need to develop clear, confidential procedures and policies so that you're processing exemptions and that you are tracking those exemptions. Those are related to medical issues or religious beliefs. And we also need to be sure if you are falling under CMS, you take additional precautions. If you do have employees who are not fully vaccinated, they have received an exemption, that we're mitigating the transmission of COVID-19 by those staff members. And then finally, communicating with all employees and all staff in those facilities about getting vaccinated, submitting their vaccination status, or applying for exemption. What I'm finding with my clients is that many times as these regulations change, the rules change, policies, procedures, forms, all of that throughout organizations, not everyone is receiving the information that it needs to know. So as this comes down from maybe different quality committees or other areas, it needs to get all the way through the organization. So the other CMS requirements, again, the CMS is Centers for Medicare and Medicaid Services. The ruling applies to healthcare workers at Medicare and Medicaid certified providers and suppliers. To number one, everyone must have their first COVID-19 vaccine dose by today. Then they also need to be fully vaccinated by February 28th. So we have pretty much end of this month and then end of next month to comply with the requirements as far as getting the vaccination.
Excellent. And then Don, we have someone raising their hand for a question. I think we'll maybe if you do have any questions, we may come to that we might answer raised hands towards the Q&A session, if that's all right.
Okay.
All right.
Now, employers are sometimes a little confused or just uncertain. How do you handle these exemption requests? First of all, it needs to be non-discriminatory. So you need to have a streamlined process where you are documenting exemptions, you're documenting any accommodations that are being made, and there are two categories of exemption. First one is any type of medical or health disability. The other one is considered, and the quote is, sincerely held religious belief, observance, or practice. So this also means that you are not required to accommodate someone who is requesting an exemption, who you know is clearly just trying to evade the vaccination. So we'll talk about each of these categories in a little more detail. So again, we need to be working with federal laws as well as your facility's policies and procedures. So you're evaluating requests under that lens as well. So if you're seeking a medical exemption, there are several things that the documentation needs to include that the employee provides to you to support their request. First one, it needs to be signed by a licensed practitioner and that this is within the scope of their practice. Secondly, it needs to specify which of the authorized COVID-19 vaccines the employee is not able to withstand. Third, it needs to contain recognized clinical reasons to the contraindications of a vaccine. And then finally, it needs to include a statement by the practitioner. So that statement recommends that this person be exempt from your vaccination requirement. And that is what that statement would include in addition to other information. When it comes to the religious exemption, there are two pieces to that. First, the person needs to explain their sincerely held religious belief, practice, or observance. It is not up to the employer to try to judge or determine if it's, quote, sincerely held. The assumption is that they do sincerely hold that. And the second piece is that it's up to the employee to make a clear connection between their belief, practice, or observation, or their observances that are religious in nature, and justifying that, making that link between their religious belief and not wanting to be vaccinated. Now, the CMS mandate, it's important to note that this does not allow facilities to have what's kind of a test out or opt out program where employees are being tested weekly, and that is instead of being vaccinated. The only way employees are not vaccinated is the two exemptions that were noted earlier. So you might want to look at cms.gov for full details on this, but a testing program is not a substitute for tracking the vaccinations and requiring the vaccinations. So there are two C's around this overall, and I think that is having consistency, right? Consistent application, consistent training. Train your managers on the processes, the forms, the procedures, timelines, things like that, and also train the employees, and then communicate throughout the organization. We need to be sure that as we roll this out to be in compliance, that this is not one of those kind of trickle-down strategies. Well, we will train managers and they will communicate with employees. We need to be sure that we are using every possible vehicle that we have, whether that's text, posting, group emails, whatever it takes, chats, texts, to be sure that employees are being trained, understand the process, and managers know that as well, including any updates and changes.
Yep. Thanks, Dawn. A couple of things. Hi, everybody. This is Frank Muscarello, Managing Partner, and I head revenue for Calcium. I think the one thing that's probably true in the C as well as the thing that's constant the most is change, right? And I think what we're seeing in the 450 plus customers that we have, they really, really enjoy the ability, and I don't think anybody on this call would disagree with the statement that, you know, HR professionals are dealing with something that they're not necessarily, they wish they didn't have to. I think if the infectious disease or COVID or Omicron or whatever it was gone, everybody would be happy. But the reality is it's not, and it's here. So you really, really have to have something in a platform that is really HIPAA compliant, because you're dealing with PHI and PII information across the stack. And you really, really have to have something that's flexible. So as Dawn mentions, all the changes from an OSHA, you know, from the ETS and from the Sixth Circuit Court and from the Supreme Court, and now moving from more of an emergency temporary standard to what's going to be more permanent, right? And there's going to be some flexibility in some of the governance that they pushed out there. You need something that's flexible, you know, not to mention there's other things in other state requirements, and different states are enforcing different mandates across the board. It is a bit of the wild, wild west. So you really, really need to have something that's flexible and can move along with you as things change. You know, you add a third booster, you really, really need to be able to track that and have it. So along that way, and within the platform of what we're all about, is we have a thing called Studio, which is really an ability for on the fly, an immediate change to happen with no, real coding or anything around that side, but really did have some flexibility to make this more personalized, right? So that you can deal with different workflows and different changes of boosters along the way. And then you've got to really be able to see ultimately if anyone wanted to look at some of the governance and look at some of the record keeping that you have in a HIPAA compliant platform, you really need to have a real-time dashboard that ultimately you can see directly what's happening, what the status is, and the focus again is around the consistency and the communication, but it's all about making the workplace safe. And that's really what Calcium and some of the tools and platforms that we have are all about. Dawn, back to you.
Thank you so much. So in addition to what was just mentioned, the issue is what, as Frank mentioned, is it's about tracking this and making sure that you have this all in one place. So when you have some type of enforcement agency that comes in and is looking for this data, making sure that you're complying, certainly the Calcium tool is going to be invaluable, including being able to run reports. So how is this being enforced? Excuse me. CMS is working directly with state survey agencies to regularly review compliance. So that's around Medicare and Medicaid. So if you fall under this category, it's going to be part of your state agency and part of your survey that's going to come through. Also, CMS expects state survey agencies to conduct on-site compliance reviews. So that could be through your recertification, or it could be through some type of complaint. And that could be an employee complaint, could be a patient complaint, could be even a supplier complaint. So to have the electronic tracking of this data will be invaluable, especially when we're looking at enforcement or if CMS or one of the state agencies comes knocking on your door. So as far as the enforcement goes, CMS and the surveying agencies are going to be looking for 3 basic process or plan categories. First one, that all of your eligible staff are being vaccinated. Secondly, that you are providing exemptions and accommodations for those who are eligible for them. And then thirdly, that you're tracking and documenting the vaccinations. If you're not, you could lose Medicare and Medicaid funding and your recertification. So, as we mentioned, there are lots of regulatory changes to stay abreast of these. These are just a few resources that are available to all of us. Obviously, OSHA, because the OSHA standard, we're waiting to see what's going to happen with their ETS. CMS, which is the governing body that is sending down all of these regulations and rules and requirements that we're discussing today. SHRM.org is very well known by HR experts. It's Society for HR Management. There's a lot of employer information available to all employers, whether you're a member of SHRM or not, on their website. And then obviously the CDC, which continues to put out updates, regulations, and requirements that are required of employers in all industries.
Thanks, Don. A couple things that we've seen and with 450 plus customers really on the Calcium platform and hundreds of thousands of downloads. The key here is to really embrace technology, because you really want to automate this as much as possible and push things to the edge in more of a consumer-centric way, whether that's via a portal or whether that's via the Calcium app, right? Really being able to leverage technology and solve the challenges that happen to be out there, right? Because everyone knows that this is a very anxious and high tension sort of time as we continue to see the changes and from an OSHA vaccine mandate perspective and really what's happening. And at one point it was more about vaccine mandate. Now it's more about testing, right? Again, keeping the workforce safe and using technology to really be able to do that. And then the concerns around this information is in fact PII and PHI, sensitive information. It has to be governed in a much more secure way, and making sure that that highest level of not only a HIPAA compliance perspective, but any NIST 800-53 security protocols that are there. And we take that very, very seriously, because we were really purpose built as a healthcare IT company around empowering consumers to take control of their healthcare data and to think and live healthier. And so the next piece of this is really just the adaptations of what's changing in the market, which is these paper cards, right? That we all have, more around a smart card technology, an ability for that to sort of move more into an automated fashion and using a QR code to essentially link to a lot of pertinent information around vaccine status, et cetera. And that's coming and actually being rolled out within some of the CVSs, some of the Walgreens, some of the Walmarts. Look for that to come in probably the first quarter, as state agencies are going to use that as much more of a widely adopted practice to really be able to push that. Using technology to integrate into that is a key component. And again, sort of looking at that strong levels of security in PHI and PII, being this HIPAA first compliant platform, really that's how we're built. So there is no skimping on that, no changing on that, making sure that is governed in the highest level of way. And then, get help with sort of logistics and planning as things continue to morph. This is not over. We don't know if other variants are going to be able to come out, but it's pretty likely that may happen. And we've all thought that this was going to go away for a long, long time ago, and it's still with us 2 years later. So you've got to be flexible and got to maintain that ability to be adaptable to the new changes that are happening in the market. Next slide. So a couple things to look for in this. Again, taking away this notion of really being a streamlined, automated, consumer-centric app eliminates the need to really kind of have paper or whatever might have been required or used by HR professionals early on as they were forced into this. Right, getting that out, because as we know, and we deal with a lot of companies that are tens of thousands of employees, with our largest with about 48,000, the ability for them to easily record that information and keep it in a very secure HIPAA compliant basis using technology is key. It has to be easy. It's got to be fast. It needs to be affordable and accessible. So as Dawn mentioned, if OSHA comes knocking or anybody sort of, is looking for that information, it can be easily presented by HR professionals in an exportable way. And it really needs to be efficient all the way through, which is why, from our perspective, being more consumer centric is really a key and a principle that we've pushed with our client base, and they've loved it and responded very, very well to it. And so a couple things that if anybody out there needs help in any particular regard, I would just say, please just reach out to me. My email's here at frank.muscarello@calciumhealth.com. We'll follow up with other links. We'd love to schedule a demo and really be able to show you some of the things that are happening here. And, we have a litany of clients, as I mentioned, around 450 and hundreds of thousands of downloads, that clients are really experiencing an excellent user experience, but it's really more about the employee experience, right? We want to make this simple. It's a nerve-wracking time. We want to really be able to deploy quickly. We can deploy this in 48 hours. You can continue to change on the fly and rest assured that it's going to be out there and secured, delivered by the cloud, and ultimately give you the ability to deal with the compliance and regulatory challenges today, but then also in the future. And so we'd love to have the opportunity to connect and show you a demo firsthand.
Thanks so much, Frank. That was Dawn Adams and Frank Muscarello. We also are joined by Catherine Singer, our customer success leader, and we would love to open the floor with any questions that you may have. Feel free to drop those in chat. I do actually have some questions we received prior to today's webinar. So I'll just share those now, and then any of our guests and speakers, or I should say hosts and speakers, feel free to jump in as you see fit. One of the first questions was, how do we keep up with boosters and the regulatory requirements?
Yeah.
Yep, sure. That's a great question. So what we have is a very dynamic pathway that contains all of the tasks that, they need to complete, whether it's first dose, second dose. Booster is just another questions that they need to answer. And with keeping up with that, we have people close to the ground knowing when these changes are going to be made. And then we do just implement them into our pathway, add in another task that says, please upload your, booster information. And it's a pretty seamless experience. Those who have not done their booster yet would just get a notification saying they need to do their booster reporting. If they just had the first dose, the second dose reported. So it's very easy to just make changes on the fly. And whenever there's a major change, like a definition of vaccination is changed, or a new booster comes out, or a new brand of vaccine comes out, we're always updating it based on those current known factors from the CDC or governing boards.
That's right. And we're also looking for it as just from a compliance perspective. We're also integrated directly into and follow the OSHA and WHO guidelines, right, as well as the CDC. So that those are continuously changing, and that is getting updated across the user base on a real-time basis. So, just making sure that you're utilizing a platform that is very flexible and extensible is the real key way to really be able to do that and not inundate the employee with too much information, right? It needs to be quick and seamless, and pushing out that information directly to the community around boosters is a key part of what Catherine's describing on the pathway.
Great, Frank. Don, any thoughts, additional thoughts on that one?
I do know that that's a question that employers are asking, and at this time, the booster is not included in the definition of fully vaccinated. And I think that the CDC is getting a little bit of heat about that. Yeah. They are saying at this time that's not something that they're including. But it's a good thing that we can track that. And I know that with my clients, we're already having people turn in proof of boosters. And so that needs to be tracked. If people are turning it in, we don't want to turn it back or turn it around or return it. So we may as well keep it and track it, because if the rules change tomorrow, then we've got that in advance.
Good point.
Great point. Yeah. So we've a couple other questions that came in from the HR exec perspective. Are we dealing with PHI and PII? And that is personal health information, I believe. Anyone want to tackle that?
I mean, the short answer is yes. In all of this regard, therefore, it needs to be held in a different sort of level and a different rigor around that side to make sure that that is not exposed to anyone else. And so whatever the professionals decide to choose, it needs to be in a HIPAA compliant basis to make sure that they are not exposing themselves to further liability. So the short answer is yes.
Don, Catherine, any additional thoughts on that? And how to best keep that secure as well? I think that's a top of mind question.
Yeah, I mean, that's a huge component of why a lot of people come to us, is because we have our HIPAA certification, and they know that if, they have to have this PHI, tracked within their employee population, it's best to do it with a company that has it. So.
Yep. I have nothing further.
Sounds good. Perfect. Then one of the other questions I think top of mind is, what's OSHA's next move? Where do we go from here?
It's kind of anyone's guess, right? I mean, like it is a moving target. And there's a lot of obviously political debate sort of around, and it's a highly charged basis. What we're seeing, and I think Dawn covered off on it perfectly. It's this move from the ETS to more of a permanent standard. What we're hearing from a legal perspective, also from the community and just from the ecosystem and at large, and what's happening around that side is, as I've mentioned before, it could be less about sort of the vaccine status, because as we've seen, the Omicron variant is indifferent to those that are those are vaccinated, those that are not. And so it becomes more around the necessity to test. And so I think what we're hearing on the ground, again, from legal professionals as well as from our client base, is it's going to be more around testing and less around sort of vaccine. So watch for OSHA to probably change and adopt that permanent standard to comply with that. Mm-hmm. Dawn, you're far better than I am. I'm just telling you what the ecosystem at large that we're talking to is hearing. But I'd love your thoughts.
No, Frank, I agree. I think because OSHA's initial offerings or requirements or legislation was blocked, and that was for a temporary standard, they are now looking at something that's going to be more of a permanent standard, and that could change at any time, but that might require a lot of training of employees, and that might be something that employers are going to need to track as well.
Great point. I think if anyone else has questions, feel free to drop them in chat. And otherwise, we'll move on. We will make this recording available after this webinar. So you'll get some email follow-ups from us about how to access this recording. And Frank, as you mentioned, we would love to help give you a personalized demo about the tool that we have to help you through this, through all of the challenges you're facing. You can email Frank again, or follow up with the email. But we've been working on this since the pandemic hit. We were very quick to respond, and our platform was such that we were able to get it actively going, quick and ready, so that we were able to help employers out quickly. And I do see we have a question from California. Yeah, so it's a great point. California is proposing reinstating the COVID pay sick leave. If it happens, do you have a system to track paperwork, process pay, etc.? Frank, do you want to speak to that?
Yeah,
one?
I can certainly. So it's one of the things that are really dynamic about our platform is really our ability to integrate directly into the HRIS system is paramount, right? So a lot of that information can be pulled from, let's just say, Calcium in via what we call an API, right, which is basically an automatic protocol that would go directly into the HRIS system and then let you manage it from there. So the short answer is yes. And a lot of our clients take advantage of that, and whether that's Workday or whether that's ADP or any of the larger sort of more enterprise ready systems. Certainly you want a single source of truth, which is usually going to be your HRIS system. So good question. And I think that'll continue as well. I think at one point, just to follow up on that, companies really wanted to keep this information separate and apart from their HRIS systems, but now they're wanting it more integrated because, just as I mentioned before, the world as we know it and living with the infectious disease or COVID as a whole isn't going away. And so you want to make sure you've got the right flexibility to deal with the right platform to give you what you need.
Great point. Dawn, any other things that you're seeing on your side?
I would say it's great that it's all integrated, as Frank is saying, and they're able to run reports, be able to not only track it and run reports and be able to follow up with employees, which is not a great process manually, but to be able to send messages, make sure you know who has been vaccinated, where are they in the process, but also to run reports for yourself and to be able to be sure that you're complying with the regulations.
Exactly.
Excellent point. Well, we want to thank you, Dawn, Frank, and Catherine, and for joining us, and all of you for jumping on. We know you're tasked with a number of things, this being one of them, and we're hoping to be here as a resource to help make your lives easier as best we can. That in mind, we will make the recording of this available afterwards. So you'll look for some emails coming from us. Make sure to check spam folders just in case, and you'll get access to this as a resource. And feel free to reach out to any of us, to Dawn, Frank, myself, and we would be happy to chat more, offer you a demo to help talk through how we can provide some personalized solutions for you, or other resources or services. We are here to support you. So thanks everyone for your time, and we hope you have a wonderful rest of your day.
Thanks everybody.
Thanks everyone.